Hello everyone, I'm Dr. Srijitra from Examla Healthcare. Today I'm here to talk about a very common medical condition which is seen especially in women's varicose veins. So, varicose veins are the engorgement of veins which can be visually seen in your leg. So, it looks like a snake crawling up your leg. The color might ranges from green to blue to black. So, usually it is seen in the legs. Sometimes you can see it can extend up to your thighs also. So, whenever I say the varicose vein, please do not restrict your idea only to your leg, because varicosity can happen anywhere in your body, in your esophagus, sometimes in your brain, internal organs. There are many areas wherein you can get the varicose vein, and the most common varicose veins are not seen in the leg. It is seen in the anal canal, as piles. So, piles is also another varicosity, which is again the engorgement of veins in the anal canal. So, how do you get piles? Piles happens because if you have too much of pressure building up in your alimentary canal because of lack of digestion, because of the gas formation, because of your too much of sitting, too much of pressure will be building up in your aliment canal, and this will eventually give rise to piles. When talking about the varicose veins of legs, let me try to answer a few questions which I frequently get in my clinic. So, what are the symptoms that you can notice in varicose vein? Initial stages or in the first stage, you will not have much symptoms, or there will not be any symptoms at all, only the color change. You will be able to visually see the veins, otherwise there won't be any symptoms as such. But as the disease progresses, you can see the swelling coming up, swelling in the legs coming up. There will be crampy pains, there will be electric shock like pains, sometimes numbness. Sometimes like tingling pains all over your leg, especially towards the night, especially towards the evening and night, it will be very difficult for you. So these are the symptoms related to varicose veins. Towards the third stage, there will be discoloration or blackening of your skin, there will be itching, ulcer formations and things like that. So that is regarding the symptoms of varicose vein. And the second question is, which people is more prone to the varicosity of legs? So as I have mentioning earlier, females are more prone to this condition because of hormonal changes, because of pregnancy, obesity, too much of standing, especially in the kitchen, lack of exercise, too much of sitting. These are the conditions where women are becoming more prone to the varicosity of legs. But men's are also quite prone to it. I mean, too much of sitting job, too much of standing jobs like traffic police. They are all very prone. The teachers, lecturers who stand a lot, these people are quite prone to getting the varicosity of legs. So, how does varicosity happens? So, the veins are one of the bloodstream which don't have a muscle of their own. Unlike arteries, veins don't have muscle of their own. So, it will rely on the muscles surrounding the veins to help in pumping blood up from the legs towards the heart. So, as you know, the veins will carry blood, the unoxygenated or impure blood down from your feet, and it will pump up and it will fill your right side of the heart. And again it will go for oxygenation, and again through the arteries it will pump all throughout your body. The veins are the one who is carrying the unoxygenated blood down from your legs, and it will fill your right side of your heart for reoxygenation. So it has to travel, the blood has to travel against the gravity, and the veins don't have muscle of their own. They are relying the muscles on the surrounding areas for helping them to pump the blood upwards. So if you, after a certain age, because of too much of standing, because of improper diet, we will lose the muscle structure, we will lose the muscle strength. Because of obesity, there are a lot of reasons why we lose the muscle strength or the muscle mass. So your pumping may not be very efficient like how we were doing in the early days. So some of the blood might be pumping upwards, but there will be some stagnated blood, and that stagnated blood is causing the engorgement of the vein, which we will be able to see it visibly. This is how the varicosity happens. As the days progress, when the stagnated blood become enormous, it will become too big, too huge, and there is also tendency that it can break and bleed. So those are the things like there is the complications of varicose veins. So this is how the varicosity happens. It happens largely because of the loss of muscle tone or muscle strength. So why I am saying all this is that you have to ensure that you include more diet or include more exercise which will build your core muscle mass or core muscle strength. So this is the one way wherein you can prevent varicose veins in your future. Okay. So, what are the complications that you can see in the varicosity? One of the frequent complications that you can see in the varicosity is that, DVT or deep vein thrombosis. So, whenever there is a stagnated blood, whenever there is a stagnant blood, there is always a tendency for clot formation. So, if at all the clot is formed and it is blocking your blood vessels or blocking your veins, it will have immediate reaction. There will be sudden swelling, there will be pain, there will be redness around the area. So, these symptoms will be quite sudden, and there will be sudden swelling of your leg. So that is an emergency condition wherein you have to get immediately treated, because dissolving the clot is very much important, because it not just obstruct the blood flow, but also there is a tendency for the clot to move from that area, and it can lodge into some other vital organs and cause you an emergency situation. So immediate treatment for DVT is very much required. And the second complication is varicose ulcers, because if there is a stagnated blood in your bloodstream, or if there is a stagnated blood in your veins, there is always a tendency for the iron to ooze out from the vein, and it can lodge in your skin. And as you know, the iron is more of an irritant, and it will start irritating your skin. And that this iron particle is the one factor which is giving black color or black discoloration to your skin around the varicose veins. It is because of the oozing out of the iron from the blood. And as you know, the iron is an irritant. It will start irritating your skin. There will be itching of the skin, there will be dryness, there will be itching of the skin, and naturally you will try to itch more, and once you do it in the regular way, the ulcer will start forming. And just like the diabetic ulcer, varicose ulcer is also a very shallow ulcer, but it is very, very difficult to treat. So once you start getting the discoloration, once you start getting the itching, it is always necessary that you take the proper treatment, because getting to the ulcer stage is very difficult, very complicated, and it is very difficult to treat. So ensuring the proper treatment at the proper time is very essential in treatment of the varicose veins. And the third complication is definitely the bleeding. So whenever the engorged vein goes beyond the capacity to hold it, definitely there will be tendency to burst open and bleed. So the bleeding will, again, it will not stop. It will keep bleeding, and again it can cause a lot of infections and secondary infections and things like that. So again, bleeding is also an emergency condition. So immediately you contact the doctor and you take the necessary precautions and medicines. How do we treat varicose vein? So we treat it according to the symptom, according to the stage, according to the symptoms, we will be able to treat the varicose veins. As I have already mentioned in the formation of the varicose vein, the lifestyle of yours is a large contributor to the formation of the varicose vein. So the treatment includes, there are a lot of lifestyle modifications that we will suggest to make the symptom go away or to reverse the process. There will be a lot of lifestyle modifications that we advise, especially in the diet, especially in standing and sitting. Too long standing and sitting, exercise part, there will be a lot of modifications. The diet will be including more proteins, because protein is very important in building the muscle mass. So it is important that you increase the protein intake. Carbohydrates intake should be reduced, because weight loss is one of the factor in which we can determine the prognosis of the varicose veins. So yeah, we will try to reduce the carbohydrates intake that you are taking. Regular exercise, walking, cycling, some kind of regular exercise is mandatory, because that will help in the circulation. Avoiding too much of standing and too much of sitting is very much mandatory, or else the swelling, the itching and everything can go high if there is too much of standing and too much of sitting involved. So at least make sure that you lift your leg while you are sitting, and while sleeping you try to lift your leg to ease out the circulatory process. And the most important advice that we give for the varicose patient is to wear the stocking, varicose stocking. It has to be worn properly, and especially during standing or too much of sitting, it is mandatory that you wear the varicose stocking. It will give an external pressure which will help in circulating the blood again. But it is also necessary that you shouldn't be doing it continuously throughout the day, because again that will cause too much of circulatory problems. So make sure you are wearing it during standing or too much of sitting, or those times you restrict your wearing of the stockings. And in homeopathy, we have a lot of medications which can reverse the process of varicose vein, especially towards the first stage and second stage. We will be able to reverse it back to normal. Medications are mainly directed in the two ways. First, medications will directly help in the circulation. That will the medications will help in circulation, and there are medications to prevent the DVT or the clot formation, and there is medication to improve your muscle mass and your muscle strength. These are the three ways in which the homeopathic medications are mainly targeting to ensure the permanent result in varicosity. So the treatment has to be in the first stage or in the second stage, because beyond that it is very difficult to reverse it back to normal. So that you all take the treatment at the right time to avoid all these complications. So that's it regarding the varicose veins. Hope you really enjoyed watching this video, and if you really have any queries or doubts, you write to us, you comment to us, so that we'll be able to reach out to you. Thank you so much for watching. Thank you so much.